Hi, good morning, Jessica. My name's Gracie Nichols. I'm the nurse practitioner. It's good to meet you.
Great to meet you.
How do you like to be addressed?
You call me Jess.
Okay. Jess, I use she, her pronouns. What are your pronouns?
She, her.
Okay. I understand that you're here today for an appointment to talk about medication abortion. Is that right?
That's correct.
Okay. What I'd like to spend some time doing today is talking first about this pregnancy and then about your medical history. From there, we'll confirm that it sounds like medication abortion is a safe plan for you and review those steps. Does that sound okay to you?
Perfect.
Okay. I always like to start just by checking in with my patients. Are you feeling confident about your decision to have an abortion?
Absolutely.
I'm happy to support you through this. So tell me, when was the first day of your last menstrual period, if you know it?
I really can't tell you. My periods are so irregular, but maybe about 2 months ago.
That's okay. Have you had any ultrasounds in this pregnancy?
I haven't had an ultrasound.
Did you take a pregnancy test at home that was positive?
Yes, I took a pregnancy test about 3 weeks ago, and that was positive.
Okay. Have you had any symptoms in this pregnancy? Things like nausea, vomiting, or breast tenderness?
I feel like vomiting all the time.
Oh, I'm so sorry to hear that. We can talk about some things to make that better. Have you had any bleeding or pain since your last menstrual period?
No.
And were you using anything for birth control around the time of getting pregnant?
I was taking pills, but I'm so bad at remembering them. So
you're not
I think
alone.
This is an accident.
Next, I'm going to ask you some questions about your medical history. Do you have any allergies to any foods, medications, or materials?
No.
And are you taking any medications?
No.
Any medical issues that you have now or have had in the past?
Just asthma when I was a kid.
I'm going to ask you about a couple of specific medical issues that are important to screen for before doing a medication abortion. Do you have any history of being anemic?
No.
Any history of bleeding disorders?
No.
Any adrenal issues?
No.
Any history of something called an inherited porphyria?
No.
And have you ever had any surgeries?
No.
Have you ever been pregnant in the past?
I've had a child before.
Okay. What year did you have your child in?
It was 2 years ago, and it was a very normal delivery, and my kiddo was 2.
Oh, okay. And was it a vaginal delivery or a C-section?
A vaginal delivery.
Okay. I think I have all of your information up to date here, and I don't see anything in your medical history that would make you not a good candidate for a medication abortion. Since you're not sure about your last period date, I would recommend that we do an ultrasound today to confirm that you're under 11 weeks in the pregnancy and that medication abortion would be an effective option for you. If you'd like, we can do that ultrasound now.
That sounds great.
So we've just completed the ultrasound. I can see an early pregnancy in your uterus measuring 8 weeks and 5 days. You are a candidate for the medication abortion.
That's a relief to hear.
I do like to offer patients the option to hear about the procedure abortion as well. Both the abortion with pills and the procedure abortion are safe and effective options when you're early in pregnancy. Do you want to hear about both of these, or do you just want to focus on medication abortion today?
Let's focus on medication abortion.
No problem. I'm going to start by reviewing all of the steps so you know exactly what to do through this process and what to expect.
Okay.
I'm going to show you a little flow sheet that is a great overview for you to reference at home if you are unsure of what to do next. The first step of the medication abortion process starts by taking this pill called mifepristone. This is a pill that you'll swallow, and if you'd like, you could take it while you're here in the clinic today. After taking the mifepristone, you'll wait 24 to 48 hours, and then take the next set of pills called misoprostol. There are 4 misoprostol tablets, and there are 2 ways that you can take them. You can either let them dissolve in your cheeks or in your vagina. Both of these are effective options, but one benefit to letting them dissolve in your vagina is you might have less nausea and vomiting than if you were to let them dissolve in your cheeks. What do you think you would prefer to do?
I think I prefer putting them in my cheeks.
That's an okay plan. Let me talk you through how to do that. You'll open up these packets and you'll put 2 pills on each side in between your cheeks and your gum, like right down here. So 2 on this side and 2 on this side. Let them dissolve for a full 30 minutes sitting in your cheeks. After that 30 minutes is up, you might have little chalky bits that are left, and it's okay to swallow those down with some water or juice.
That sounds doable.
Okay. What time do you think you'd like to take this mifepristone at?
I really like to start as soon as possible, so if I could take it now, that'd be great.
And when would you like to take the misoprostol?
I have tomorrow off, so I probably want to do those pills tomorrow in the morning.
Okay, I think that sounds like a good plan. We'll plan to give you the mifepristone today, and you'll take this misoprostol tomorrow morning in 24 hours. Now let me tell you exactly what to expect after you take the misoprostol. Most patients have bleeding that starts pretty quickly, like within a few hours of taking these pills. The bleeding will be heavier than a normal period, crampier than a normal period, and you'll pass clots and pregnancy tissue, so you want to be prepared for that experience. I usually recommend that patients are home for about a day after taking the misoprostol tablets, if possible, near a toilet, really just able to have some time to take care of yourself. Any questions about what to expect after taking the misoprostol?
That's clear.
Okay. Most patients will pass the pregnancy tissue within the first 24 hours. You will probably have some bleeding that continues for about 2 to 4 weeks with this process, but that bleeding should be getting lighter over time. It's typically just the first few days that are the heaviest.
Okay.
Next, I'll tell you about things to look out for and reasons I'd want you to call or come in to the emergency department. The first is if you're having really, really heavy bleeding. Remember that we expect you to have heavy bleeding with this process, and you might have some gushes of blood, and you'll pass those clots. But if you ever have bleeding that is so heavy that you're soaking 2 pads in an hour, and by soaking I mean like totally saturated, front, back, side to side, and that happens for 2 hours in a row. So that would mean you soaked 4 pads within a 2-hour window. That would be too much bleeding to be having, and I'd want you to call the numbers that we give you and plan on coming into the emergency department. There's a chance you could need the procedure to control or stop the bleeding. The next thing to look out for would be really severe pain. I expect you to have intense crampiness with this process, and things that should help that crampiness are extra strength ibuprofen, which I'll send to your pharmacy. You can take 1 of them every 6 hours to help the crampy pain. Heating pad, hot water bottle, and just taking it easy tend to help too. But if those things aren't helping and you're continuing to have severe pain, that's not normal, and it would be a reason to call us and come in.
Okay.
The last thing to look out for is signs of infection, like a fever. Know that these pills, the misoprostol tablets, can cause a low fever for a few hours as a normal side effect. But if you have a fever over 100 degrees that lasts more than 4 hours, that's not normal and could be concerning for infection. It would be a reason that I want you to call and come in.
Got it.
In terms of follow-up, you have a few different options. We do recommend patients have some kind of follow-up check-in within 1 to 2 weeks after medication abortion, just to confirm that everything sounds like it happened normally. While medication abortion is really safe and effective is effective at causing all of the pregnancy tissue to pass over 95% of the time, in a small number of cases, patients might have a small amount of pregnancy tissue that remains in the uterus, or a failed medication abortion where the pregnancy continues to grow and could be affected by birth defects. Although this risk is very low, it makes it important that we do some kind of follow-up check-in. You have a couple of options for how to do that. One option would be to do a televideo visit where we just make sure everything sounds like it happened normally, and then you take a home pregnancy test in 4 to 5 weeks to make sure that it's negative. The other option would be to come back into the office for another ultrasound. On ultrasound, we would just look to confirm that we no longer see the pregnancy in your uterus. Which would you prefer?
I think I want to really confirm I'm done with this process as soon as possible, so I'd like to come back to the office.
Yeah, I think that makes sense. We can absolutely make a plan for that. We'll schedule you a 1 to 2 week in-office follow-up visit before you leave today.
Great.
I'm next going to go through a few more pieces of paperwork that we need to review before taking these medications. First is an instruction sheet with our phone numbers listed at the top and detailed instructions about how to go through the medication abortion process. It also has a review of the reasons we'd want you to call and our follow-up plan.
Okay.
The next document is called the medication guide. The medication guide is an FDA-required form that essentially reviews, again, the process of a medication abortion. You'll find there's a lot of repeated information within all of this paperwork that we'll give you. The medication guide essentially reviews all of the steps of the process that we've reviewed. Next, we get to the signing of the forms. The first form we'll go through is called the patient agreement form. This is also an FDA required form, and it essentially says that I gave you this medication guide packet, that we talked about the steps of a medication abortion, the risks, reasons to call us or present to an emergency department, and what our follow-up plan is. Take a moment to review this now, and when you're ready, you can sign.
I'm ready to sign.
I'll sign too. This is a blank copy of the patient agreement form. I'm required to give you a copy of this, so I'll add this to your paperwork. The last form to sign is our clinic's consent form for a medication abortion. It essentially says that we reviewed the other options, including no abortion or a procedure abortion, that we talked about what to expect with the medication abortion process, and that we reviewed the risks. Do you have any questions about this?
No questions.
Okay, again, you can sign when you're ready.
That is a lot of paper.
It's a lot of paperwork. I'm gonna put everything together for you in an envelope, and I'll put your pills, the misoprostol, in the envelope as well.
Thank you.
Yeah, of course. To recap the medications I'm gonna send to your pharmacy, we'll send the extra strength ibuprofen, and I can also offer Zofran, which is an anti-nausea medicine. If you'd like me to send the anti-nausea medicine to your pharmacy, I'd recommend that you take it about an hour before taking the misoprostol tablets. Just try to reduce the chance that you would have nausea or vomiting. Would you like that prescription?
I would love it.
Okay, I'll send the Zofran to your pharmacy. You can take one of them every 8 hours as you feel like you need it.
Sounds great.
The last thing we can talk about during this appointment today, if you're interested, is options for birth control. Is that something that you'd like to discuss?
Not today. Thank you, though.
Okay, no problem. If you want to talk more about that in the future, you can always reach out. That's everything that we need to review, so we can start the process now if you're ready of taking this first mifepristone tablet.
I'm ready. Thanks for going off through all the instructions.